neurological symptoms. These are the main symptoms on those exposed immediate exposure. Now there are certain signs. What I told is symptoms. But when you look at the patient, what are the signs? The most important sign was tachycardia. Tachycardia means heart rate is beating. Heart is beating fast. That was the important finding. And again, another important finding was they were afebrile. There was no temperature. Therefore, the patients were having high heart rate and also breathing rate is also rapid. Therefore, they are breathing rapidly and also heart rate was very high and they were all afebrile. There was no fever in these individuals at that point of time. Now coming to, because at that point of time it was not possible to do any other investigation. The priority was treat the patient. The large number of patients coming, they were to be treated immediately, and these are only the retrospective analysis of the data for the Gandhi Medical College published by Dr. N.B. Misra. Now coming to the subacute phase, that is from January to March 1985, I was asked by ICMR, I was in Chennai at that point of time, to take the pulmonary function equipment from Chennai and go to the Bhopal and start the studies on the gas victims. On that basis, I took the pulmonary function equipment from Chennai, brought it to Gandhi Medical College. I did the studies on that equipment. You see here, even after 3 months of exposure, see the pulmonary symptoms were persisting. See, I told that initially, soon after exposure, nearly 98% of subjects has got breathlessness. Now after 3 months, again nearly 81% has got breathlessness persisting. Similarly, cough was persisting 84. Somewhere 95% has got immediate, and again 75% has cough persisting. That means even after 3 months of exposure, respiratory symptoms were persisting in these subjects. Now, the problem is symptoms are there. Mere presence of symptoms doesn't mean that has produced any damage to the lungs. For that purpose, we have to do the investigations. Therefore, I did the pulmonary function test with the equipment I brought from Chennai. These are the results. You can see here, these are some technical words. I will explain what it is. See, these are some of the technical words that you say fever. And what does it mean is, when we are taking drug and expelling air, there are some values will be obtained. And also the volume that is expelled in first 1 second is also known as FEV1. These are some of the volume that is being expelled by the individuals. So you can see here, when compared to all the values has to be compared to the control values, normal predicted values. When compared with the normal values, both males and females, these two values, all these values are significantly lower. You can see the star here. See, these people should have had, see, let us assume that 3.9 liters, see, they had only 3.3. That means 6 and the continual difference. That was significant statistically. In females also it is like that. All these values were, that means those exposed to the gas, even after 3 months, the pulmonary function was significantly lower compared to the control subject. Therefore, in addition to having symptoms, they have got also abnormal pulmonary function changes. Now what had happened is again, see again you should know that at that point of time, the first question was asked was, this is a single massive exposure to the gas. Will it produce any permanent lung damage? There are different opinions at that point of time. Some people are telling that it's only one time it has occurred for some time, nothing will happen hereafter. Some people are telling that no, it can occur, lung damage can occur on a long-term basis. But we should have scientific basis for telling all these things. Again, 1985 to 87, I again took the bronchoscope from Chennai to Bhopal. This bronchoscope is an instrument we can see inside the lung. That is passed through either nose or throat, we can see inside the lungs and take the fluid from the lung. And this is analyzed and see what is happening in the lung. I did that study and I will show the results now. See, when we look at the cells, you see normally also in the normal lung, there are certain types of trellis. I am not going to areas. See, compared to control areas, even if they are away from the way, nearly 5 to 10 kilometers, they have got nearly 25% of individuals have got abnormal pulmonary functions persisting even after 10 years. Now this is the study done by the NIRE at the ICMR. You can see here, see the pulmonary morbidity. This is not pulmonary function. The morbidity studies you can see here. You see, these are on the mild, moderate and severe. See, pulmonary morbidity is very high, 21%, in the severe, and also you see control it is only 4.4%. It's an epidemiological study in the field. Pulmonary morbidity is very high in the severely exposed population, even in both males and females. Females 23%, 5.51% the control subjects. See, ophthalmic morbidity were also high in the exposed population. Therefore, if you look at this, in the community also, this problem was persisting. Now coming to, this is the recent study. See, there was a respiratory, when I was working in area, one respiratory clinic was started. In this respiratory clinic, patients were brought from the field for detailed examination with X-ray, pulmonary function, etc. to make a diagnosis. These are some of the patients you can see here. See, all these subjects has got not one disease alone. Most of them has got more than one disease. In this population you can see here, one disease was present 62%, two diseases 26%, three diseases 7%. Therefore, nearly 33%, 34% has got more than one disease. It is not only one disease they have got, multiple diseases are there in this population who are exposed to this. Therefore, this is again an important finding. Now, if you look at the pattern of the diseases in this population analysis, you can see here COPD, that is chronic obstructive pulmonary disease, present 43%. Hypertension, high blood 30%, bronchial asthma 25%, diabetes 11%, coronary disease 7%. Therefore, the main disease present this one, COPD, that is chronic obstructive pulmonary disease in 43%. See, what is the significance of this finding? See, you can argue this is not an epidemiological study. Agree it is not an epidemiological study. It is a sample coming from the field, brought to the head to give them proper treatment, run them, analyze this. But I will compare with another situation. See, you all know that Patel Institute, Delhi. That is also not a community-based hospital. Patients are coming, mainly respiratory diseases. They are analyzed. You see what are the findings from there. See, this is the 10-year data from that particular institute from 2000-2009. The main disease there, that particular institute was bronchial asthma, 43%. COPD was 18%. These are other diseases. Therefore, in a normal situation, in a hospital, respiratory disease, mainly it is bronchial asthma. And only 18% is COPD. But in this population, local population, what had happened? So here, the main is 43% is COPD, bronchial asthma is only 25%. That is an actual reversal of what is happening in other hospital situations. Why it has happened? We should also expect here bronchial asthma high, COPD to be second. But here COPD is high on the list, bronchial asthma is second part. Why it is happening? Therefore something has happened, the gas has done something. There is some explanation, I will any question comes, I will answer. See, these are all human studies, what happened to the autopsy studies. These are autopsy studies are all done by Dr. Sriram Ajari, who was the additional Director General ICMR and also Director of Institute of Pathology. He has done all these studies. So you can see here, immediately after 72 hours, lungs were logged with a distinct red color, trachea and major bronchi short, acutized in observable changes, microscopic findings, severe tracheitis, bronchitis, denudation, epithelium. There was marked congestion, thickening of the alveolar septa. These are the autopsy findings within 72 hours of after death. These are the findings, you see thickening. Here you see this alveolar spaces are almost empty here. There is no fluid here, but you can see here this